everyone. Shalom, good afternoon, good morning, or good evening, whatever time you're tuning into this podcast. My name is Bryce Pettiford, and I'm back again as your guest host. And today we got a special treat for you.
Yes, I am your new guest host, Jason Posley. Glad to be here with you all.
Man, if you don't know about this man, you're missing out. I'm going to pass the floor to him, give him a little opportunity to tell him a little bit about himself.
Yeah, so I grew up in Shalom Church, City of Peace. Been here since I've been a baby. Grew up here in St. Louis. I just finished college. Finished college at Maryville University. Got my bachelor's in health science, and I'm continuing my education. This fall, I'll be attending Webster University to get my master's in health administration. Hopefully, one day I can get a job in health equity and make sure, our minorities, our Black and brown people are getting access to quality health care and things like that. So,
as you can see, this guy is great. This past month, June, was Men's Health Month, and we like to bring awareness to this topic, especially Black men in particular. And Jason, I can definitely say I'm excited to talk about this topic.
Definitely, I love this topic. It's my favorite topic.
And similar to Jason, I will be completing my degree in health science, so we definitely have a nice background to many classes in the field and a good inside take that we can provide to you all today. And I mean, the first thing that comes to mind when I think about men's health is that African American males have the lowest life expectancy in the United States of all demographics. So this really definitely hits close to home.
Definitely. Yeah, man. Just like you said, a lot of our Black men, we losing them earlier than any other, population in America. And I think honestly, all the leading diseases, all the leading causes of death in America, I think they are more prevalent in Black men. So, like diabetes and asthma, things like that, I believe they're more prevalent in Black men. It's more to it than just, I feel like the things people blame it on, like our diet, things like that. I think it's more of a systemic issue, bro.
Okay, can you talk a little bit more about the systemic issue?
Yeah, so I would say, I think with the pandemic, I think Dr. Fauci called them the social determinants of health. And those would be just the different things systemically that cause Black and brown people or minorities to live a certain lifestyle. So, people always say, well, we have a poor diet, but what they don't talk about is a lot of people that look like us live in food deserts. So like a food desert is a place where we don't have access to healthy foods. So we often do a lot of grocery shopping. Maybe some people grocery shop at a gas station. I see a lot of gas stations that say like mini marts and things like that. So I know you've seen it too, especially in the city. Those mini marts sell like groceries, like TV dinners, things like that. And some of those people, that's the only grocery store they can get to.
That's true. I definitely grew up eating TV dinners at nighttime.
Exactly.
Things like that. And I think, especially going to Maryville University, being in town and country, which is a completely demographical area, definitely seeing things like Whole Foods, a lot more different food options, which in my neighborhood where I grew up, and you definitely grew up in a similar area,
Exactly.
We didn't have many of things like that. And that's definitely an aspect that plays into the systemic barriers preventing African American men from receiving equitable health. I think another thing is the stress, especially in many of our health classes, especially I talked about various amounts of diseases. One of the top things that lead to receiving that disease or being diagnosed with that is stress and the mismanagement of stress.
Yeah, definitely, bro. I feel like health is intertwined. So I don't feel like it's all about physical health. I feel like everything is tied in between, mind, body, and spirit. So if we are stressed out, I feel like that just leads to, poor physical health as well. Poor mental health could lead to poor physical health. So I know we learned about stress eating. So we definitely stress ate in college, growing taking finals week, studying up late at night, 2, 3 a.m.
That is true. Definitely. Yeah,
We
I've
snacking.
been there.
Yeah, we definitely snacking, eating, things like that. But then when you talk about like the major causes of stress with Black men, man, like the trauma we've been going through. I know you could speak about that.
Oh, for sure. I mean, especially growing up, unfortunately, I lost my father at an early age. And I think that was a large stressor in my life that I was never really able to come to terms with. I had to attempt to compartmentalize it rather than actually go through the grieving process, which, I mean, I wish I could go back and talk to my younger self because, shoot, I mean, that was one of the most severe losses in my life, but I know people who have lost brothers, multiple cousins. That's a whole nother topic for a whole nother day about, like, the killing of Black men and things like that, but the stress and the aftermath of it is something that nobody ever really talks about. Yeah. I'm glad you definitely threw that live to me.
Yeah, definitely, bro. It's just things like, man, going to high school, school lunches. A lot of people I went to high school with, lunch was the only meal they were eating during the day. Like, sometimes those lunches it was not an adequate amount of food. So just knowing like that was their only meal for the day. I know I didn't look forward to lunch. I was blessed enough to, have meals. I never really worried about a meal, but other people that look like me, really just only eating at school and only eating at lunch. I could only imagine how stressed they were at school, worrying about being hungry at home, worrying about helping their mom or their dad make ends meet at the house. So I just, and that can lead to poor physical health as well. We learned a lot about sleep. We don't rest often. So it's just a lot of things that lead to this, lead to our life expectancy being low.
That definitely is true. And I think a theme that we've already got into is like how younger generations really aren't too concerned about health or really think of health as something like they should value at an early age. Yeah. And what's your take on that? Is that something you think?
I think we're trending in a better direction now. I know, mental health is at the forefront of our talks right now. So we're very fortunate to have that going on. I know my parents, their generation, I don't think mental health was a big topic back then, or as large as it is now. I would say that us young people, we're focusing on it more. I see a lot more young people at the gym, running in the morning, things like that. What about you?
I mean, let's see. I got a different take on that. I know I grew up son of a nurse, so I've always been in the healthcare field. But even like cousins, loved ones I grew up with, health isn't something they really even talk about till you get into that age, or until you're like, a lot of diseases, a lot of disorders, they occur in 40-plus-year-old people or older people. I personally didn't really get checkups, and I know most of my family never really got checkups growing up. We just, waited till something came, tried to, all right, we're gonna give you some medicine, get some rest, and often prolong seeing help, really. So, I mean, for me, it's something that I want to see a better trend. I want to see more people concerned about their health, but I know like the large costs associated with it. That's something that also played into the you're gonna try to take care of it at home. You're gonna try a little home remedy first, drink some tea, lay down.
Oh yeah, robot testing, all those things. But that speaks, to the larger systemic problem. Like if we go to the doctor and maybe our job, the jobs that we work, the people that look like us, the majority of us, we work jobs. Sometimes they may not give us, insurance that can give us good quality health care, or a network of hospitals that give this high quality care. So we may not be able to afford going to the doctor or getting checkups every year, things like that. So, but that speaks to how America has, we don't work to prevent, we work to treat.
That is true.
And so I think that's the major problem right now.
Yeah, I would agree, especially like overpopulated hospitals the African American communities, different things like that, especially the mistreatment of African Americans when they do come to the hospitals.
Oh man,
that'll lead to a mistrust. It's just a plethora of things.
Oh man, yeah, I could talk about that forever, bro.
I feel you. Another thing, we were given some of these statistics. I want to read off a couple.
Okay.
So the first statistic I have is 230,000 men are diagnosed with prostate cancer every year, and 44% of men are considered overweight, and 37.5% are obese. And that definitely goes into the diet, especially being in a food desert. You don't have as much access to healthier foods. And I know that prostate cancer is really, really impacting our older African American males significantly. I mean, everybody can know somebody who has dealt with that in their personal life.
Yeah, that actually really hit home with me, bro, because I lost my grandfather to prostate cancer. He beat it the first time, and then it came back the second time. And then, unfortunately, he passed away. He went on to the Lord because of it, but it is something that impacted him. And, you know, those type of things have a history in your family. That's one of the more reasons why, you know, young people should start taking their health seriously, because these type of diseases, they can creep up on you. I think it's prostate cancer. I think Black men, we're advised to get our prostate checked before anybody else. I don't know. It might be age 40 for us, or 30, one of those. So yeah, just prostate cancer in general. And then what did we say? 37.5% of men are obese. Like that statistic, like that's really almost half of us. So
sure. I mean, yeah, like I talked about, things that trigger incidences of diseases are things like stress, obesity, and genetic factors, which, I mean, as you see, we just read off multiple things that impact the African American male, but I don't think many people really understand the impact that they have, especially like this age. Yeah. I'm at age coming off where like high school, you know, you play sports, then you get to college and, you know, the freshman 15, and then sophomore 10, and next thing you know, your weight is a concern, and it's almost you trying to react to it rather than stay on top of it. And I definitely personally think a lot of people our age don't really think about the impact we have today on when we get to the age around 40, and you got to start getting those checkups, and then you looking back, wish you did something different, wish you developed different habits.
Definitely. And I don't know, I feel like the education system can be intertwined with this too, because we didn't really learn until we got to college how important our health was. You know, in PE, you know, we used to play games and run in PE. Now PE is kind of like, you know, throw out the basketballs, you could play if you want to, or sit in the corner on your phone. So it's just like being active. The importance of being active. I don't know if it's stressed enough in school. I think that's why young people, I feel like that's why they don't work. That's part of the reason why they don't exercise as much as they should. I know you used to tell me how much you played outside as a kid. Do kids still play outside a lot?
I've been going back to my old neighborhood. I ain't really see no kids out on the street like it used to be. I mean, as soon as school was out, you got about like an hour to do your homework, and then you got to be at the corner trying to catch everybody else outside.
Exactly, man. Like being outside, and then that street light come on, and you got to be back in the house. But I don't know if we see that today. But it's really important, man. It's like really important to get outside and to go play. Like just be active.
For sure. Definitely stress that, especially with the increase in technology. See, I had to look for the bikes out in the front yard to find where everybody's at, but now they probably just get on a group FaceTime and they never even leave their home.
Man. Yeah. It's a different time for sure.
Yeah, it definitely is. And I mean, hopefully we can get ready to transition. I know Pastor Clark is gonna have some amazing.
Oh yeah.
Amazing.
Yeah, I can't wait to hear what he has to say to us about this.
Let's slide straight into it. Pastor Clark, thank you so much for being with us. And I want to thank you in advance for the knowledge you're about to drop off to us. And I'm personally excited. I know everybody viewing it is really excited. But if you're ready, we can slide right into it. So, Pastor Clark, how good are you at keeping up with your own health and things like diet, exercise, and getting checked up, going to the doctor and things like that?
Yeah, Jason, Bryce, good to be here. Good to see you all, man. You know what? I could have just as well continued listening to both of you all with the very pointed information that you shared, very important information that you have shared. I would add very necessary. And so it was not flattered for me to say that what you have been talking about is so very important for those that are looking in. And I'm sure that once one or two people hear the content of your expressions, they will call a friend and a friend and a friend, and before you know it, your words are going to ring loud in our community. Very, very profound what you said dealing with health. How do the status of my health? I believe it or not, I'm not on any medication. I walk every other day. I do have a routine. I try not to share that too much because I want people to think that, that I'm able to get up without grunting with no having to do no work. But for persons my age, I think it's important that we have a consistent routine of health care. Yeah. To go back to one of the words you said, Jason, prevention. It is harder to move in the area of correction than it is prevention. I can praise the Lord. I can eat just about anything I want. I do not have any of the named issues that you have talked about, blood pressure, sugar, any of that. Been blessed in that area because I understood early that if I was going to carry out my spiritual assignment, I needed my body to do it with. And without my body, or trying to do what I do at the level that I do it at without my body being healthy, then my calling would suffer. And so I'll say to anybody that whatever your vocation is, whatever you long to do professionally, that it matters that you take care of yourself. If you want to do what you're going to do at a top level, at a high level, you have to have your physical body in order to do that. As it relates to health issues, I can only echo what you all have said because Black people we live in a food desert. Transportation to a supermarket becomes an issue. Yeah. So the best that we can do sometimes is to shop at I don't even know what you call these places, gas station, quick trips, things of that nature. So you try to get everything that you need. If you don't have any transportation, if you're not mobile, if you can't do it, it is the equivalent of not having your body. Because your body is the form of transportation as well to get you to do some of the better things that you hope to accomplish. So So my first thing is to make sure that people understand that their first priority is to make sure that they take care of their temple. That's what the Lord calls it, our temple. That if you take care of your temple, then your temple will provide you the means to carry out what your purpose, whatever your assignment is in life. Again, exercise, do all of those kinds of things. That when I was a boy, I had 7 siblings. Well, just 7 siblings, and we were all in the same house with a couple of cousins. And so, needless to say, it was a full house. It was a full house, and so when we got sick, the doctors and nurses were our mother and grandmother that gave us castor. I preached this the other Sunday too. Castor. They took our temperature, and if we had a temperature, they treated it with a cold rag. Yeah. And until the temperature dropped. If it was something that was infectious, then they put us in a room and put a sheet to cover up the doorway. Nobody could come in there. They would vaporize the room and then put Vic salve all over your body. And we never read the instructions on that, but I'm sure, because you all are headed toward becoming health professionals, but I'm sure somewhere on that label it said, don't internalize. But I guess my grandmother and them couldn't read because they put some on our tongue and then told us to swallow it. And fevers broke. We were ushered back into our daily routines because of that kind of care. And so it wasn't the medical care that you would get from the institutions, but it was care that was mingled with prayer and love for the patient, which leads me to say another thing about why some Black folk are reluctant to go to the doctor. Yeah. Because the level of care is missing. Not to say anything about if you're not insured. And so if you have to go to a safety net hospital, such as we have in our community, then when you get to the emergency room, it's 100 people in front of you. And so you've got 2 physicians on staff in the emergency room that's in place to maybe see 50, 60 people that night. So when you go, you better go and take a sandwich because you're gonna be there for a minute. And so it's all of those things. And so when you get a chance to be seen by the doctor, and if you're a Black man and they tell you that you have high blood or sugar or some of that, given that information alone doesn't help us. Yeah. Does that make sense?
Yes.
It doesn't make sense. You've got to since my condition dictates a life change, then I'm counting on my physician, my doctor, to then tell me how I can move forward with the changes that I'm gonna have to make in my life. Don't just give me the medicine and just think that this is gonna do me well, because I've got a lifestyle. I've been living this certain norm for a certain period of time. And then when you find out if you got high blood pressure and they give a Black man high blood pressure pills, and then he discovers one of the side effects, we need another conversation for the side effects. Yeah. But he discovers the side effects and how that messes with stuff. Yeah. Then he becomes mental. Then it becomes mental because now not only is my physical health being compromised, but how I mentally process everything else enters into the equation. And so rather than going to the doctor and getting better, I've walked away with a prescription with no advice about how I can allow all of these things to work by seeing how it holds together. Exactly. Yeah, does that? That
makes a lot of sense.
Yeah. So, but the way to deal with that is to do preventive stuff, as you all were saying. And I'm only repeating what I heard you all say. That the way to get at all of this is that how can we inform our community in the processes of doing your health care before you get sick? That seems to be the key.
Yeah, exactly.
Yeah.
Definitely agree.
big challenge, but that seems to be the way to go. And you all are the voices to help do that. Then when you look at people my age, we might be too far gone.
All right, thank you everybody for tuning in today. I know you got a lot of good things to take away from it, but if you want to continue the conversation, feel free to reach out to us at thezconnectionpod on Instagram and Twitter. And we want to thank you, and we want to encourage you to be on the lookout for more episodes, and definitely tune in to Sunday's worship. Thank you.